Welcome to today's talk session. My name is Deidre Moss, and I'm the host of Can We Talk? I'm an educator, motivator, and a talk connoisseur. For our session today, we will be talking about skin bleaching and skincare. Skin bleaching is a long-standing issue within some of our communities, and it's very important to dissect this topic due to the negative impact that skin bleaching can have on persons who engage in that activity. So for this collaborative session, we've invited Dr. Llorenia Muir-Green.
Your
I know you would have had to correct me, who is a noted dermatologist to help us dissect this topic. And at this time, I will pass the virtual mic to our guest so that she can introduce herself.
Hi, thanks again for inviting me. So I am a dermatologist, as you said. I graduated with my degree in medicine at UE Mona campus in 2002, and then I went on, 2007, sorry, 2002, I had done my first degree, which was in chemistry and biochemistry, and then I went on to do my further training in dermatology, came back to Jamaica, and then afterwards I went and did further training in hair loss. I did a fellowship in Vancouver, and I've been back in Jamaica for at least since my fellowship from 2014. I am the head of the department at Cornwall Regional Hospital with respect to dermatology, and I'm a past president of this or association, and I try my best to keep in the academic realm. It kind of gets overwhelming when you work in government, but such is life.
Thank you. Thank you for that introduction. And again, just want to thank you for being a part of this session today. I do know that you are definitely knowledgeable about this topic. And it's very prevalent within some of our communities. And so I think it is worth us to have this talk today. And so just before we start, before we begin, if you just joined us, like and share this video. Subscribe to our YouTube channel using the links on our page. We need your support to continue these talks. Also, if there's something you think we should be talking about, feel free to let us know. We want to hear from you. Let us know if you would like to advertise on our platform or sponsor our program. We want to grow. We want to grow. So with that, let's get into our talk. I will ask you about your background. Sorry, can you tell us a little bit about your background?
In terms of dermatology or okay, so I got into dermatology mainly because I really enjoyed it in medical school. It's one of the few areas that I really, really like. I mean, I was good at some areas. Like when I look back at my grades, I'm like, oh, I was bright. But I wasn't necessarily loving medical school. And this area I really, really liked. And I got into dermatology because at the beginning of the millennium, 2000s, I got into a lot of hair care forums and groups, and I was saying, if I'm going to become a doctor, I don't want to be a hair care doctor. I need to learn about hair loss. So when I went to my first American Academy of Dermatology meeting in 2012, I believe, I said, I went to all of the hair loss talks, and I was like, this is the area I definitely want to go in. So I know for sure. And I remember before I ended med school, somebody asked me, a resident was asking me what I wanted to do. And I said, I actually want to do um, dermatology and focus on trichology. And that's exactly what I went and did. So in terms of, I have a hair loss clinic at both at the in the government at both the Cornwall Regional Hospital and the National Chest Hospital when we have the skin clinics in Jamaica. I again, as I said, I am the head of the department um, of dermatology at Cornwall Regional Hospital, and we conduct, you know, clinics all over the western region of the island. And I do still liaise with my colleagues abroad. There, the hair community is very tight. So a lot of times when we go to conferences, we see the same faces, and it's invariably it's almost like I know your face, and you know, and it's quite a lovely community because we're now I want to do studies. I've been saying this, and I'm hoping and praying that the one that I want to start will start next year, because um, the hair loss that affects Black women specifically are very traumatized because there are scarring alopecias, and meaning that if you don't act on them quickly, the hair will never grow back. And so I have a lot of those patients, and I want to do extensive studies in that. I also want to do other studies in derm, because you don't have a lot of literature on Black people in the medical world with respect to dermatology. Not only that, you'd have very little information coming from the Caribbean. So if we have any information about Black skin, it's from America, not even so much in the UK, and UK have a good amount of Black people up there. But certainly America, and you know, some of our African counterparts are doing some amount of work, especially in South Africa. They're actually churning out more information, and it's important that we actually discuss all of these things because um, you know, as much as we are all human, we all express genes differently, and we all, you know, and certain conditions actually, you know, present differently in different races. So, or even in that territory. So yesterday I had a wounds conference, and the doctor, one of the surgeons, was saying that the sickle cell ulcers that people would get, so the HBs, the sickle cell patients who will get ulcers on their legs, the ones that they will see in the States are different from the ones that they will see in Jamaica. And it seems as if there's a particular um, distribution, and the question is why would that happen? And that is what we need in medicine. Just like how now in Canada and other places, if you're going to prescribe certain anti-epileptic drugs, especially in an Asian population, East Asian population, you have to do certain blood tests to make sure that they can tolerate it. So it's things like that we actually need to broaden, get the do more studies, get the information out there so that we can say, okay, this person has X, we need they would respond in a particular way if you give them this drug, all of that stuff. So that's what my interests are in.
Thank you, and that's very, very informative. It's interesting to, I would like to ask you, you know, why you had kind of leaned more toward becoming a hair specialist, if it was something that maybe inspired you. Just interesting to hear you speak about that.
Mhm.
And talking about those issues within our communities, both of those are very relevant as it pertains to hair loss,
Mhm.
alopecia, and also bleaching as well. So you kind of touch those areas as it pertains to your specialty. So I find it very interesting. I don't know if you want to add anything to that.
Um, Worldwide, almost all Black women will experience some sort of hair loss, whether or not it is cosmetic related, you know, by stuff that we do, like, you know, you flat ironing hair or something like that, or you did a silk press and your hair breaks or something like that, or and then or dependence on wigs, weaves, and other tension hairstyles always um, gives some sort of issue with respect to hair loss. And then there are intrinsic hair loss that we are experiencing, and we're not quite sure why we're experiencing. I'm seeing that when I came back to Jamaica, I have an idea. That is why I'm going to start doing a study to figure out if there's a strong connection. I'm seeing some trends in my patients, and I want to prove that it's not just an association, but an actual maybe causation, or like a heralding sign that, okay, if you see this hair loss, do these blood tests. The so getting into hair loss was, I don't know. I just said I couldn't be a hair care doctor. I didn't want to become I mean, I did do some amount of cosmetic chemistry, so I had started making my own products. I need to get back on board on that. And I said that I couldn't be just telling people how to take care of their hair, which I've had patients come and see me for, like, person come in, I'm thinking, okay, you want me to look at his scalp? No, doc, I want you to tell me what to do with my hair. And I'm like, shouldn't you be asking your hairdresser? But we're still, even with the knowledge base with respect to hair care for people of African descent, it's getting better, because most of our stylists are trained in styling, not hair care. So they don't know how to preserve the hair, how to ensure that when the next time they come in, are chopping off another 6 inches, because you're just styling the hair and not actually properly caring for the hair. And hopefully with all of this knowledge that we are having now, we'll have better care of our hair and better care of our scalp. And therefore we can retain our hair as much as possible. And as you know, that's a big business, because I mean, when this whole natural hair care revolution started, all you had, you probably have the Blue Magic and those kind of products on the market, and then and what's the lustrous pink oil, those things. And then now it's a whole bunch of stuff. People go inside and they can't figure out what to buy. Shea Moisture, Alikay, this, that, and the other.
You can pick, choose, and refuse.
Right? It's like you don't know what to do. They're overwhelmed. I can see them with the sensory overload. And sometimes people who know me that I'm a doctor, then, and I'm going through the pharmacy because I'm looking for something, and they're like, doc, you can't help me with it, because really and truly it is overwhelming, coming from nothing to all of a sudden thousands of products on the market.
Definitely. Thank you so much for sharing that. That's definitely a topic to explore in and of itself, as we think about hair loss within our communities, and the hairstyles that we often wear, the braids and all these things we have going on in our communities, which can contribute to tension and hair loss. And so that's a topic in and of itself. But as we dive into bleaching and skincare, we want to look at why is skin care so important? And anyway, go ahead, sorry.
Well, skincare is important because your skin is the first thing that you see. And people don't see your heart, people don't see your kidneys, people don't see your lungs, they see your skin, and they judge you according to how you look, right? Everybody come, but how she looks so. And that kind of, boy, she can't take care of herself, how her hair stays so. I mean, people make such comments because it's the first thing that you see. And in the Caribbean, we are not afraid to just say it out. Just use the inside voice. I like to tell people, just use the inside voice. You don't need to comment on everything. And so persons are affected by all of the image, how they are perceived. And you want it. The skin is the largest organ. It needs to be taken care of properly. It ages pretty rapidly, especially if you treat it poorly. So, persons who are always going out getting tans, or if, they're not actively getting tan, but they are actually in the sun all the time because they're farmers, etc., they're more at risk of getting like skin cancers, and Black people do get skin cancers. We have several patients that, other than the albinos, and albinos will be prone to. I'm talking about regular, highly melanated folks, or highly pigmented folks who actually come in with skin cancer. Not that as common as say white people, but they do exist. And there is, people just think about skin and just think about the skin itself. And then there's the hair care as well as the nail care. So another thing that I like to make people aware of is the whole gel manicure. Everybody going in every 2 weeks, they're putting in a new gel manicure, but they're exposing themselves to UV. Remember, remember,
Oh my gosh, gel manicures?
Yes, because remember, you're having UV radiation on your skin. You don't normally, I mean, most people in the Caribbean are sun avoidant, right? So they, they try to protect, that is part of the reason why a lot of us, even the white people out here, they're not exactly always running to go out in the sun to get a tan. A lot of them are like, I can't bother, the sun too hot, I can't go, can't manage, and they stay out of the sun. So they actually are not as like when they come into for their annual mold check, they don't have as many problems as persons who actually come from like, northern climes, and they're, as soon as the sun come out in the spring, they're in the sun, they're on the ground by the park getting a tan. So that whole thing with the UV thing now, remember, Black people are more prone to melanoma on the hands and feet. This is what killed Bob Marley. He had what we call acrolentiginous melanoma of the toe, and he didn't want to take it out, cut it off, and all sorts of drama, and that's why it spread elsewhere. And melanoma is a very fast spreading skin cancer, and I'm not quite sure why, but we're seeing an increase in number. At least every year for the past 5 years, we have diagnosed at least 2 to 3 in our clinic. And I know we have other persons who have been diagnosed in other areas. And so we're trying to figure out what is causing this sudden increase in skin cancer. So now you're looking nice and it glammed up with the nails, but the whole, remember, we're more prone to melanoma on the hands and feet, and then you're getting deliberate UV on your hands and feet on a very regular basis. The American Academy of Dermatology says you should actually try to wear sunscreen when you're getting it, but I don't know how that will work out because actually rush off this and all sorts of things. And I just tell people to just cut down how often they go in for the gel manicure.
Oh wow, I had no idea.
Yeah.
Oh
yeah,
wow.
it's going to be an issue in the future. It's certainly going to be an issue in the future for sure. For sure.
Oh wow.
So back to just general skincare and everything. People want to, it's the first sign of aging. Everybody saying if your skin looks terrible, then you look older than you really are. And you want, everybody needs to keep it moisturized and keep it healthy. Drink your water from inside, to get the good amount of hydration from inside, and eat, have proper diets and proper nutrition to keep your skin looking nice and healthy and plump. Right now, when we go off into doing all of these things to our skin, like bleaching, that's where things go awry, because we're using all sorts of agents to actually depigment the skin, and each agent can damage the skin in a certain way, as well as cause long-term effects over time. So the most common, should I go into that, the most common bleaching agents that they use?
Sure.
Okay, so the most common bleaching agents that people use include the steroid creams. So the steroid creams are the hydrocortisone creams. Hydrocortisone is the lowest strength steroid cream, while you have really high strengths that go all the way up. So the persons mostly get the very high strength steroid creams, and steroid creams are used. These are anti-inflammatory creams that help to quieten the skin, like persons who have psoriasis, persons who have eczema, and those kind of conditions that need, that need some sort of topical agent to help to calm it down. Now, what they do is they use the highest dose. So they know that a side effect of these creams is bleaching of the skin, right? And so what they do, they paste, lather it all over their body. And then in order for it to get proper penetration, they actually use saran wrap to wrap around so you can get up, better penetration.
What is that, Sandra?
Yes, the saran wrap to get penetration. So
Oh,
the
oh wow.
skin is the skin is not that, even though it's permeable, it's not that permeable. And so we do that as well as physicians when we want to numb your face, to do burning off things on your face and stuff like that. You would put on the numbing cream, put on this the cling wrap or saran wrap, and then leave it on, and it helps with better penetration. Otherwise, if you just left it on by itself, you may get some effect, but you may have to leave it on a lot longer than if you didn't use that the cling wrap to get the penetration that you want. So these persons are head to toe encased in this thing because they're all about getting the skin looking good in their minds. Now, as you would imagine, if you are using these creams, the highest dose on skin that is not problematic skin. So, you have a problematic skin, you're trying to correct it. This is normal skin. You'll put this on. So a lot of times when our patients with psoriasis, we have to let them know, try not to get it on a normal skin too much because it will, start causing problems. So they're now 10 times the effect of what they were if they were just using it for just a regular skin problem. And they get all of the side effects that you can get with these steroid creams. Some of them include steroid acne. I've seen head to toe acne, face, chest, back, thighs. It was terrible. I've seen severe or horrendous looking ringworm. So normally ringworm, you just get one, right? One little ringworm, you get the cream over the counter, or that doctor prescribes something for you, you put on the antifungal cream, you're good to go. With these persons, because the skin is not you are actually suppressing it, the function of the skin. So the anti-inflammatory creams, what they do is to actually, calm down the inflammatory process within the skin, right? And so if you're putting it on normal skin, you're actually stunting how the skin reacts normally. All right. And so any kind of, you're more prone to infection. So if you catch ringworm from somebody and it's slathering this all over the body, you're going to get it all over the body. So we've had whole chest, whole back ringworm. Persons with bacterial infections of the skin. So you can get what we call a folliculitis, where you get individual pus bumps around each hair follicle, and it can have the whole thing on the body like that. We've had persons with one of the main side effects that you can get is stretch marks, is really big stretch marks, very red and angry looking, and people call it bust up skin out here. And they can get other things, and if it's too much that is being applied on a daily basis, they can get systemic absorption of the steroid, and then they can get increase of their blood pressure, all sorts of drama. Yes, all sorts of drama. So when these people come in, we actually have to assess them properly, so that they may not even think, well, they know that things can go wrong, but their aim is to look a certain way. And some of the persons, if they're highly motivated to look that way, then they're going to continue. Even if you give them a treatment, they get rid of everything, and then it said, all right, a good no, they start again. While others get the problem and they're like, I'm done with this because it's take up too much of my money, because it's a lot of money, I mean, buying those creams it's not cheap. And then all of the problems that you have with it, that is another story in and of itself with respect to correcting these problems. Especially if you don't have a socialized healthcare, it can become expensive pretty quickly. So we see all sorts of side effects with these persons, and what we don't like, it's bad enough when you have the adults doing it. It's another story when you have the whole family doing it together, and you know, you have this 8-year-old who is being slathered in these creams by the parents, and it just, yes, whole families, absolutely crazy. You try to talk, but it's part of body dysmorphia. So as we know with body dysmorphism, it's very difficult for them to see that there's nothing wrong with them. And with the advent of social media, things have gone really out of whack with respect to body dysmorphism. You know, everybody getting a BBL, a lipo 360, they're getting their nose done and cheeks done, and it's more widely accessible. There's nothing wrong with getting these things done, but you have to look at why you're doing it. If you're going to say, all right, I want to look cute and I want to do a little thing, fine. But then there are those who end up getting addicted, and then they keep changing and changing and changing. I mean, I saw a photo of Gwen Stefani the other day, and I'm still trying to figure out who is that person. She looks nothing like the woman that she used to look like. And that is what happens, especially if you have any kind of low self-esteem. You get hooked on this, and then you completely become a totally different person. And the whole bleaching is part of that. So out here, a lot of our patients who are doing, they go to Dom Rep and they get their BBL done, and maybe get a boob job as well. And then they come back, and then they're starting their regime for their bleaching in order to get the look that they desire.
Wow. That's a lot to swallow. But this is some it's some scary stuff when you think about the negative impact that it can have on persons' well-being and their health. And I don't know if you've seen the videos with the steam where the skin literally melts off.
I've seen those, and I'm trying to figure out what is it that they're using and how is it they're able to do that. It seems unreal. But I've seen them. I really don't have any comments on those, because I really don't know exactly what they're using, because they don't necessarily say what they're using in those videos. I just see them and I'm like, what is it? How are you able to get that?
I know that the temperature seems to be extremely hot because you could see the steam in the video, but if you're peeling off your skin, the only thing that comes to my mind is what's going to be the impact of you removing a layer of your skin.
Disordered, a lot of things ends up with disorder. You end up with disordered immune system of the skin. So just like how a person who gets burned, they're not able to sweat properly, they're not able to, everything is affected.
Oh, wow.
So there are persons who, there's a condition called Stevens-Johnson syndrome and toxic epidermalysis necrosis, where people take a drug, any drug, even simplest of drugs like Tylenol. This has happened to people. It doesn't happen to everybody. It's a very rare condition, but they end up losing their skin. So when their skin starts to grow back, when they've lost their skin, they're not able to maintain their temperature. They're cold all the time. They're more prone to skin infections that can eventually take up the entire body if you don't get on top of it quickly. They're more prone to having, because of lost protein from the skin is protein, their protein in their body goes low. They can get swelling of their body because of that, because it's a natural response that happens. Persons can get high potassium, and high potassium is not a good thing. that can actually stop your heart. So you have to monitor these patients carefully. They are, like I said, and when the skin starts to grow back, it grows back disordered. So they don't have the nerve cells, growing back in the way that they were, because everything is a pattern. Everything is done in a certain way. The sweat glands may be gone, all of these things, and they end up having not sweating properly. And that can be a problem for some persons because you're trapping in the sweat when it really should be releasing, and you get hotter than usual.
Wow.
And yeah, there are lots of things that the skin complexion doesn't come back to what it used to look like. It looks very disordered because the pigment grow back in different ways. All of these things that you never thought about, everything becomes very disorganized when the skin starts to heal.
Oh, wow. Wow. I just want to go to our comments for our viewers listening in. If you have any questions or any comments, feel free to share with us. We would love to hear from you. I want to take us to another question as it pertains to the do you think that people within our communities are cognizant of their skincare?
We are very aware. I mean, we have traditions that have lasted centuries. This whole slathering down in cocoa butter and shea butter has managed to stay on for you have cocoa butter lotion here, there, and everywhere. So it has stayed on in terms of cleanliness of the skin. We're very much so into showering, ensuring that, and sometimes too much. Sometimes we're a little bit OCD. Hands washing all the time, and then they end up having eczema developing from that. But we are very, people have routines from their child, where their parents would put on Vaseline all over the entire body. And so that whole aspect we have preserved worldwide, actually. We actually have preserved. So we're aware of how to take care of our skin. It's just that, due to various, what I would call subconscious thought processes, we have decided to go against that. And we all know what this is from, enslavement and colonial and the subsequent colonialism, and what we see are remnants of that. I mean, when you look at the Miss Jamaicas over the years, not that many are my complexion, and it's the truth. Not that many are darker than me. Most of them are light skinned, and it actually, subconsciously puts into the brain that you who make up my skin complexion is the majority of Jamaica. I am in the majority and I am not considered beautiful. There's a problem. You understand? I was shocked that, in the last few years, they've actually, voted in dark-skinned women as Miss Jamaica. But we've had all variations, persons who are Chinese, persons who are Indian, light-skinned Indian, not even dark-skinned Indian, light-skinned Indian, white, mixtures of all of those, black and mixtures with all of those. And if you see that, then you're going to think that I don't look good. And then our music don't help, because with our music, you always hear about somebody talking about the pretty browning. There's always some browning in Jamaica means a light-skinned person. There's always some reference to that. In
what is it called? What is it called in Jamaica? Brownie?
Yeah. So
brownie to refer to light skin?
Yeah.
Person? Oh, yeah. Wow, okay.
So in other rest of the Caribbean, I hear yellow bone and red bone, but
well, we call it mango skin. We call it mango skin in the Bahamas.
Oh, okay. I've heard about yellow bone and red bone and yellow skin and all of those
Yeah.
combinations. But in Jamaica, we call it browning. And
Okay.
so the brownings have persons see when you have that kind of reverence in the music, you can't, that stays in him, that stays with you. I remember, um, um, you know, I remember when I went back natural many, many years ago, and people were wondering why. Like this was in the 30 odd years ago when I was a teenager, and people were wondering why would you? No, not 30 odd, not like 20 something. I'm aging myself. So the people were asking me why would you want to go back natural, because I'm like, because I want to. And then I did it spectacularly. I cut off all of my hair like Doja Cat.
Oh wow, you went wholesale.
Bald.
Wow.
And people were traumatized because I have very long hair. I mean,
Wow.
longer than this.
Wow.
And to them, that is long hair. And I was like, this is what I want to do. And people are traumatized. And my idea, because I had a wider view of life, looking at different, seeing different things. And I remember looking at a woman who had her hair with her hair, when I was growing back my hair, having a wash and go, it was an Aveda flyer. And I showed this to my friends and they said, doesn't her hair look nice? And they're like, no, looks terrible. And 20 odd years later, that's what everybody's wearing. And it's just because we've changed our perspective and how we look at ourselves. There's a whole lot that we need to open up and actually acknowledge. We've done it many times. Pardon me, speaking to persons and trying to see what motivates them to do what they're doing. So especially with the bleachers, like when the bleaching epidemic started in the 90s, the older set of dermatologists would go around to schools showing the pictures of what could go wrong, all of these things, and people continued anyway. And actually, it's actually worse than now. We're actually having way more persons bleaching. Before it was relegated to women, now men and women are bleaching their skin.
Wow.
And like I said, persons have rope in their children, which is kind of this.
Oh wow,
that's a good idea.
It's like the whole family.
Yeah,
is bleaching together.
And people forget that children are not, pardon me, mini adults. They are actually, everything is different. And the dose that you would use on an adult, if you use the same dose on a child, is twice the amount, meaning twice the effect that they're getting. And so I'm sure they're absorbing way more than usual. And those persons, they have to watch out for like stunting in their growth, stunting in their puberty, getting to puberty, all of those things that are, that they should be looking forward to, but it's being impeded because of what their parents are doing to them.
Definitely is definitely a scary thing, especially when you think about entire families who are engaging in this activity together, and young persons who haven't even fully developed yet engaging in this activity is very scary. And then also it's costly. And so to think about the fact that I saw with some persons, they skip essential items to purchase their bleaching creams because, again, these items are expensive. So I know persons, they put off getting things that they should get in order to buy these bleaching creams. I'm like, okay, so this is a really serious addiction. And so it's a scary thing.
I just wanted to talk about some other agents that they're now using. So we have hydroquinone, which is used over the counter to help with depigmenting and for dark spot correctors.
Okay.
It has been recently banned in the States because of, you can, if you use it for too long, you can get what we call ochronosis, which is very hard to treat darkening of the skin, especially on the face. And but we have them out here in the Caribbean. Now, especially like Ambifade cream, those kind of products that have them in usually the 2%, which is the mildest. For dermatologists, we kind of go higher for what we want, especially if we have melasma and other things that are contributing to the darkening of the skin. So there are persons who use that, and then there are persons, and some of the combinations or creams that they have available, proprietary creams, they say that, oh, they only have natural products. But when we see the patient, we see the results, the side effects, and we know that that's not true. They actually have steroids in them, and they probably have hydroquinone, and they may not even list that they have hydroquinone in them, or even the strength of the hydroquinone in them. And so we as a dermatologist have to fix all the problems that come in. There are persons who are using glutathione. So glutathione is very popular in South Asia, Southern Asia, and East Asia, right? And so we're not the only ones bleaching, the whole world bleaching. And once you have some kind of pigment going on, everybody bleaching. And in the South and Eastern Asia, they use the glutathione not as creams, but actually injection. So this glutathione is a natural product that you produce in your own body, and it's almost like something like in the realm of antioxidants in that realm. And it has been shown to lighten the skin. There are creams available. There are persons who have been injecting themselves with it, with higher doses, right?
Injecting themselves with cream?
No, it's a just like how you get the IV drip. They get the injection of the liquid glutathione, and they also have tablets. So people buy the tablets online. They can get the creams online, and then and then they can get the more potent version, which is the injectable kind, at probably some doctor's office. Okay. In comparison to the steroid creams, they're less problematic in terms of the amount of side effects, except for the injectable type. The persons will have to monitor the kidney function and liver function. All sorts of story, but I'm sure most of them don't do that. Some of the proprietary agents have added things that's supposed to help with the penetration, as well as other fancy ingredients that actually may irritate the skin. So sometimes when we see the patients, their skin looks very red and angry, and they're like, what are you using? And they show you they may have the hydroquinone that can cause irritation, as well as a variety of things in there. And then people get creative. So there are persons who buy the bulk bleaching agent that we have out here, and then they add stuff like actual re-bleach. Make it make sense. I don't know why. Some people add curry, which is turmeric. So turmeric is known naturally to bleach the skin, and that's been used for thousands of years in India. So they have lots of turmeric containing creams on the market, especially in Ayurvedic practices. Some of the agents that we have out here actually have turmeric in there, but persons add the curry, and I'm not talking about regular, just plain turmeric alone, the actual curry with the other spices in there. The actually adding all sorts of craziness, they all sorts of craziness, and mixing them together and hoping for the best. And then they end up with a lot of irritation of their skin.
So what about because I know persons who make their own batch. I know you spoke to that, but I know people, they make their own, they put their batches together, they do their mixtures, and they sell it to I guess persons who are interested.
Right.
it's a lot going on, but
No,
so,
you know, I mean, it's big business. If you make it up and you can give them whatever they are going to, you know, some of the natural agents that we do have, like, especially you will see in the dark spot correction creams include, niacinamide, um, L-arbutin, um, um, licorice roots extract, and some other extracts. Now, those are on themselves, by themselves, those natural ones, where they use all of those extracts, they're not as potent as, say, the steroid creams. So what people would do is get those, mix up with the steroid cream and mix up with something else, and then use it all over their skin, and along with the other things that don't make any sense, like cornmeal, making it like it's just a whole lot of things. But um, the they're very enthusiastic about what they're doing. Um, like I said, there are persons who, when they realize that things can go very wrong with their skin, they eventually stop. But there's some that, you know, as soon as the thing heal up, they go right back to what they were doing.
it's very interesting. I know in conversations with persons who may use dark skin correctors. I inquire. I'm told, hey, I'm not bleaching. I'm just correcting my color. So, I mean, is that true?
Okay, so it is all what you're trying to do. So dark spot correctors, everybody who's pigmented is going to have some sort of dark area somewhere. If your legs are rubbing together, or you get insect bites and they heal with dark spots, and you know, if they get the acne and they heal with dark spots, it can be kind of traumatizing, even more so than the actual acne itself. Um, the So persons go seeking help for that, and if they use it in the right place and not using it everywhere, just on the areas that are affected, they won't have much of a problem. But what some persons tend to do is that they don't want to say that outright that they're bleaching.
Yeah, right, exactly.
They have another term for it. So in Jamaica,
Yes.
we call it toning of the skin, which is
yes, yeah, exactly, right.
not really bleaching, you know. So sometimes
Yes.
I have to ask the patient, so you're toning?
Right.
They will say yes.
Right. I mean, they don't want to use that term, but I mean, now I'm trying to figure out, you're using some type of cream, your color is changing. So what are you doing? What it is, what it is.
They don't want to admit it. They don't want to admit it.
No. So is there a way to revert? I know you talk about treatment. I know you talk about offering treatment to those persons who would have been impacted, but is there a way to reverse the side effects of bleaching?
Not all of them. It's very so if you come in with body acne, we have to give you anti-inflammatory antibiotics for a longer period than we would necessarily give somebody who has acne, regular acne, along with acne medication, etc. Persons who are you know, get the stretch marks, they can get laser treatment or microneedling. The problem is that the skin, especially if those who are using the steroid creams, have thinned out significantly. So it's so thin that they show up bruises very readily. I've had patients where you're trying to actually anchor the IV granula into the skin, and it can't anchor because the skin is too thin. All sorts of drama happening with their skin because of what they've been doing, and it's a bit difficult. It's more like a waiting game. So if they tell them to stop and they decide on stopping, it's going to take a little while for the skin to heal itself and get back to or correct to as much as before. It may not get back to what it was previously, depending on the kind of damage that they've sustained, especially with the ochronosis. Ochronosis is very difficult to treat.
Oh,
Um,
wow.
it's very hard to treat. I mean, you could try laser therapy, but not everybody has the funds for laser or
Yeah.
access to a safe laser in their neighborhood or etc.
Wow. Yeah. I've heard persons say before, they would have bleached, but after they stopped bleaching, their skin got darker.
Mhm.
I don't know, what's going on with that. Um,
Um, I'm not quite sure. There it says there what could happen is that depending on what they're doing to their skin, if they had some amount of irritation or redness happening along with the bleaching, they're going to heal with darkness because a lot of persons normally heal with darkness. So you say you get a sunburn. So if you go in the sun and you get red from the sunburn, it's the same way they end up healing with darkening. So if you're using a product that is actually not only just bleaching the skin, but also irritating at the same time, you're going to heal with darkening. And it's a very difficult darkness to get rid of. So a lot of times you get this rebound darkening and depending on what they've been using, depending on what they're using. Another
okay.
thing that people don't think about is a long term, another long term effect that people don't think about is
Mm-hmm.
what is it? Are them? They're going to be more prone to skin cancer. The good thing about these
Mm,
people that they're extremely sun avoidant. They're extremely sun avoidant. They are not in the sun. You see them with a big hat. Well, even if they're walking around in
right.
the sun, broad
Yep.
brimmed hat and all sorts
Yep.
of stuff, head to toe, they're covered up.
Mm-hmm. Mm-hmm.
So that's the only thing beneficial with them is that they actually practice good sun avoidance. Um, but they are more at risk for skin cancers and some other things in the future. And we're not going to know exactly what it's like because the boom just started maybe about 30 years now. We will see what it's like when these persons turn 50, 60, 70. That's what we're going to have to look forward to.
Yep. So we are winding down. We've come to our fast talk segment. We give you 60 seconds to answer each of our questions. First question, why do you think skin bleaching continues to be a prevailing issue, especially within our communities?
Um, the whole what is projected as what is beautiful, the music videos kind of and the music actually puts that out. The girl invariably, almost always, the lighter skin girl, the darker skin girl is never usually the one that is focused as the girl that the guy wants, and you are going to internalize that without even thinking, and you actually try to mold yourself to look like that.
Thank you. How can we address the issue of skin bleaching within our communities?
um not Try not to berate people and try to see why they're doing whatever. It's not about belittling them and trying to say no, you're not, you shouldn't be doing this because XYZ, and or because it's self-esteem issues, and they're like, I don't have any self-esteem issue. And just go ahead and just say, all right, perhaps you may consider stop doing it because of XYZ that is happening to your skin, and just work with them gently. Is you're better off going from a more gentle perspective than a more authoritarian perspective.
Do you think that skin bleaching will continue to be a prevailing issue, especially within our communities?
I still believe so. I do believe so. It's gonna take it took hundreds of years to inculcate this thought process. It's gonna take another set of 100 to come out. I mean, look at India. India banned the caste system how many years ago, and people still doing it because the caste system is ingrained for 3,000 years. It's kind of hard to get rid of it. It's kind of hard. So it will be around for a while.
Definitely. So I want to turn the session over to you. If you have any additional comments you would like to share, anything you would like to add, if you want to share any links to your pages, feel free to do so.
Sure. My Instagram handle is Dr. DrLLORENIAMUIR_Green. And you can find me on Facebook with my name as well. I do have another page, which is askthehairdoc.com. It's a little bit quiet right now. It's been quiet for a few years because I've been doing a lot with respect to my work, but I do plan to reactivate that and focus more on my hair loss, a lot more in the future. With respect to the topic at hand, I think that as a group of people, we need to not dance around the elephant in the room, acknowledge that it is there, try to see if we can heal that what is missing within ourselves, so that we say, okay, I don't need this person to validate me, or I don't need to look a certain way to feel loved or validated. And we're going to need it even more so now, because again, social media has made everything that much worse. I remember looking at magazines in the 90s, and they were talking about eating disorders, and it was more a white people thing. And then now it's just everywhere. It's everywhere. And the ideal look. So now in the last 10 years, it was being thick boned and having a big butt, etc., etc. But they're going to swing back to they're now swinging back to the skinny chick, and the whole heroin chic that was a thing in the late 90s, early 2000s. And it's imperative as parents, as caregivers, to actually bring up your child to not be that heavily influenced by outside, because they're going to spend their entire life trying to look a certain way, be a certain way, and never feel whole within themselves. And that is the saddest thing of all.
Thank you. Thank you so much for sharing that. So we've come to the end of our session. I would like to thank our viewers for listening in. I would like to thank our guests for joining us today. I am not going to say your name because I don't want to mess it up. Muir-Green.
It's not a very common name. It's very few Caribbean countries have Muirs there. So
okay,
don't worry about it.
Well, I wouldn't even say the first name.
Struggling.
I wouldn't even say the first name.
The Llorenia. You actually got my name right.
I did?
Yes, you did.
Oh, wow. Oh,
yes, you did. Because
let me try again. Llorenia.
Yes.
Muir-Green.
Right. You're almost getting there. But the first name, definitely correct. Definitely correct. Yes.
I want to thank you for sharing with us today and talking about this very, very critical issue within our communities. Listen, I've seen the girls and I've seen the videos. The girls look pale white and they're saying, you can have skin like mine. Just order this cream right now. And they look good. The color look good. And so it's tempting, if you want to, you're not comfortable in your dark skin. Yeah. I mean, I'm not incredibly dark, but I have dark skinned persons in my family, and I've seen, the impact that having dark skin is what that has on persons.
Because I mean, even Nicki Minaj, who has completely transformed herself, she wasn't that dark. Now she's like 10 shades lighter, nose change, breast, bottom, the whole works. And and when you see it, you kind of think, okay, this person is getting more clout, so to speak, more attention, then I should do the same, not realizing that everybody needs to look, it's good to be unique. It's good to be unique. Everybody can look the same. Then if everybody looks the same, then there's nothing.
Well, outside of the looks part of it is the impact, the skin cancer that you could possibly get, the disorders that you can get. It's a negative impact that kind of prevents me in thinking about, okay, if I do this to my skin, what's going to be the impact later now? That is more scary to me. You can develop skin cancers, and like you said, this is becoming prevalent in melanated persons. We haven't really seen, you know, those skin cancers really impaired, but it's becoming more prevalent now. So it's this is a very scary thing.
Yeah.
So I would like to thank you for joining us today. I would like to thank our viewers for listening in. Like our page for future notifications, comment under this video, let us know your thoughts. You can also subscribe to our social platforms on the addresses that we provide on our page. And remember, let's think, talk, do. Thank you. Have a great day.
All right. Thanks.